This is an instructional video for the ED physician utilizing Cerner FirstNet. When you log into Cerner, you will see that their storefront has two icons for FirstNet. This one will launch you directly into FirstNet. The one that says FirstNet Dragon will launch you into not only FirstNet but Dragon Medical One as well, which allows you to use the Dragon Medical One dictation system. For this purpose, I'm going to go ahead and log into just FirstNet, just for the ease of login for our demonstration. You would be launched in automatically after you've been properly accessed the system for the first time. In my case, I'm going to have to go ahead and type in my username and password, but this would happen automatically for you. When you log in, you will see the ED launch point as displayed here. You can adjust your view if by chance you choose to, increasing or decreasing your size. Some people do like to go down to like a 75% if they prefer that. It will allow you to see more things on your screen if you make that size smaller, but I'm going to leave mine at 100% for this recording. Beneath there, you can see that there are different ways to filter the system. So if you happen to have certain patients that you are assigned to, you can filter it by just clicking on My Patients, and that would list just your patients. In addition, you can look at all beds. So this is FTMC all beds. It would show you every bed that has a patient within it, within the ED launch point. Your next view is the FTMC split flow, and this is specifically those patients who are in the split flow area, those kind of quick in and out patients. We do have 4 split flow areas within our ED, and you can see those listed there as exam A, B, C, and R. There are further filters that you can utilize. This again would bring in My Patients within the split flow. I'm going to move back to FTMC all beds and show you My Patients within FTMC all beds as well. You can search for those patients who are as yet unassigned, and because I am logged into the system as a provider and there are no providers assigned to any of these patients, it's showing me all of them. I can also filter empty beds, so if I wanted to, I could include my empties. As you can see them displayed here, bed 9, bed 10 being empties. Most providers tend to want to keep that empty beds shut off, though they don't care to see the empties, so they just deselect that. The waiting room. This allows you to pull in the waiting room patients. We happen to have one patient down at the bottom of our screen in the waiting room, and you can see that by deselecting that, I would take away that waiting room. Some like to see the waiting room, others maybe less so. This filter for critical values does not function at this time, but the no dispo, you can click on that and you would be able to see of the patients in all the beds, which patients do not have a disposition put in yet, either an admission or a discharge. As you travel to the right, you can see that you have statistics related to the number of current patients that you have, how many have you had in the last hour, how many patients today, and then, of course, your median door to doctor time specifically for you. As you travel further to the right, these are statistics pertaining to the unit as a whole. So there's one patient in the waiting room. We have one pre-arrival. There are currently 11 patients. And you can see last hour today. Median length of stay of the patients and also median door to doctor time. There is a search field here in which you could place any patient's name and find them via this search. This is not a searching of the entire Cerner database for patients. This is just searching for patients within your ED launch point currently being seen. The launch point will display your name here in the right upper corner, and then if you click on this drop down, you can see I am currently checked in, but I'm going to go ahead and check myself out so I can illustrate to you the process of check-in. So if I was coming on for my shift, I can come right here to check-in, and you can see the display name here. That could be changed if you chose to. And then, of course, I would pick my provider role, in this case, ED physician. And if I do select a default relationship, same ED physician, I won't have to say every time I log into a patient's chart that I am the ED physician, because I have selected this to be my default relationship. You'll notice here that you can associate a provider color. So if I click on that, you'll see that you get a whole myriad of colors here, and you can even select from this more diverse menu. I'm going to just click one here and say OK. At this point, you would say OK, and you are officially checked in. Because the ED launch point, if the launch point is full of many patients, you might want to utilize this caret here, which collapses the statistics and the filters a little bit for you, so that if you truly had this displayed to all beds and all beds were full, you would be able to see everything on your ED launch point and not waste that space with the filters or the statistics. As we move across the launch point here, I'm going to review the various columns with you. The first column is called your throughput status, and I'm going to get rid of my no dispo so that I can just show you a variety of those. If you hover over the color, you will see the throughput status. In this case, the lavender illustrates that there is triage needed on this patient yet, so nursing has not completed the triage documentation. If you travel over to this status column, you're going to notice that that same information is populated for you here in text, that triage is still needed on this patient. If we go back to our throughput status column, you'll notice that there is the color shade of blue, and this darker shade of blue indicates that there is a discharge order. And once again, if I look at my status column, I can see that there is a door present, and that's indicative that this patient does have a discharge order. So as you hover over, you will get to see the various meanings of the different colors of the throughput status column, including the gray, which illustrates that this patient is ready to be admitted, so gray illustrating such. If you see a light blue shade, that indicates that an evaluation is in progress, so the physician is within the workflow working on deciding what's wrong with the patient, placing orders, etc., but has not yet started their note. If we proceed down to this dark purple, this is indicative of a pre-arrival. So as you adjust to utilizing the ED launch point, make sure that you remember that your throughput status column will provide you with the status of your patient by simply hovering over that color, and you'll see where they're at in their whole process of their visit in the ED. The next column is your room column, and it basically lists for you all the patient rooms. You can click that header and sort your rooms in an inverse order. That could be helpful if perhaps I was caring for patients in the split flow area and I wanted to have my split flow patients at the top. Or we can click that back and it'll just place it in the order again with CDU at the beginning and then the remainder of the ED beds, followed by then finally the split flow area. The next column pertains to your patient information, and if you look here you will see that you have a patient name, you have their age, and you have their sex. You'll also see various icons here, including starburst icons. In this case, if it is a yellow with a green surrounding starburst, that reflects that this patient has no known allergies. If you see a red burst and hover, you will see not only that the patient has allergies, but you can see what they are allergic to. I don't know if I have an icon here that reflects it, but if you see, yes, this one here, it looks like there's a pill there, and this one illustrates that the patient has no known medication allergies. So what I would like to show you here is, if I were to click on any of those icons, and I'm going to select this one because it has a good listing of allergies, if I click that icon, I will be able to see that it sends me into my patient's allergy screen. And I can not only see the patient's allergy, the substance, but I can also see the reaction, at which point I can mark them as reviewed. So it is easy to launch into your listing of your patient's allergies by simply clicking on the icon. A couple of more important icons that I would like to speak to you about in the patient information column would include this paper, which illustrates that there is a pre-arrival note on the patient. So if I were to click on that paper, I will be sent directly into the pre-arrival note, and you can see things such as the date, the time, who took the pre-arrival, and then any other sort of information that was received when that particular patient was called into the ED as a pre-arrival. In addition, if we come down here, we can see this icon, back to pertaining to allergies. This means that no allergies were documented, so it would be important that nursing documents the allergies early, because if you do attempt to put in a medication order, you will hit a hard stop if you don't have patient allergies documented. There is another icon here which reflects your patient. There's a patient with a little piece of paper behind their head, and that reflects a critical note. So if I were to click on that icon, I can see here that I'm sent into this very important piece of information pertaining to the patient summary. And as you can see, we're in the category here that represents that human head. And if you look down here, you can see the patient summary, including what we were referred to, the critical note. Specifically, that will take you to the patient's advanced directives. This is a hyperlink, and it would send you directly to the scanned documents that the patient has on file in our system. Before we move out of this box, though, I want to point out that you've got lots of great information here, including triage information, the reason for visit, vital signs. You can even see here prior visits. So if your patient looks familiar to you and you're wondering, did I see this patient recently? You could see not only the patient's past visits, 5 of them in total, but you might also see their future visits, which could give you information as well. You could see your patient's home medications listed, as well as their histories like medical history, family history, procedural and social history. So it's a very valuable screen. You could open your patient's chart from here as well, and you can also launch to patient orders. I'm going to go ahead and close that down though and continue to talk to you about the patient information column. There's one final icon that I wanted to point out to you. It looks like a traffic cone, and that icon symbolizes that this is a workers' comp situation. So maybe someone slipped in the parking lot and now we're seeing them for workers' compensation. Before we move beyond the patient information column, I wanted to let you know that you can click on your patient's name and you would be launched into their chart. We're going to wait to launch into the patient chart until we've reviewed our various columns. Next to the patient information column, you do have your acuity column. So based on very specific questions that are filled out by the triage nurse, the patient will be placed into a category for their acuity level. In addition, I wanted to point out that by your room numbers, if your patient has a critical alert, for example, a possible SIRS or possible sepsis alert, it will populate around the patient's room number in red if it is a high-level alert. There are other alerts that are not considered high level. That would be something like a trauma 2. If you see a trauma 2 populate around your patient's room number, it will appear in gray. If by chance you had a patient that had more than one alert, for example, perhaps a CERS alert and also a STEMI alert, you will see the corner of this red area flipped, and that will just reflect to you that if you hover over it, you will see that the patient has more than one alert within our system. As we move on, this is the column that illustrates the emergency physician column, in which you can associate yourself to the care of a patient. So if I was the emergency physician and I wanted to illustrate that I am caring for this patient in CDU bed 1, I could simply click here and I will get a pop-out screen that allows me to say that I'm going to assign myself to this patient's care. When I click it, you will see that I am now assigned in the emergency physician column, and if you hover, you can get more detail about the name, which maybe does not completely fit within that box. The next column is for your advanced practice providers, such as your PAs, so they will simply go into that column and assign themselves to patients just as you did as an emergency physician. The resident column is utilized by the residents, but it's also utilized by our medical students. We don't have a column for them, so when they are here helping us out and learning, we do have them log into that resident column. But if you hover over their name, you would be able to see that they're not a resident, but they are a medical student. And lastly, you can see the RN column, and in a couple of cases, we have nurses that have assumed the care of these patients. So hover and you'll discover the name of the nurse who happens to be caring for your patient. If by chance you wanted to take yourself off of a patient assignment, you can simply click on there and unassign yourself, as easy as that. But I'm going to go ahead and put myself on this patient again, assign. As we move on, the next column is our patient details column. I'm going to move down to this patient here with chest pain. So the patient in bed 4 came into triage and stated that they are having chest pain. So the triage nurse put that in there as the patient's reason for visit. In contrast, if you see something with a DX in front of it, that means that either the PA or the physician has gone in and placed a diagnosis. So DX should always be present on all of your patients as you examine them and determine what exactly is going on with your patient, and you do place that diagnosis. It will convert the reason for visit into the diagnosis that you place. So it's very important that on every patient you place a diagnosis so that it is illustrative of what you have determined is happening with that patient. Additionally, you are able to make comments here for other staff to be able to see. So if you clicked on this plus sign, you'll see that you can place a comment here. And just by simply saying save, you have placed a comment. There is the ability to place more than one comment. You can have a total of 2 on display, or if you chose to, maybe you wanted to change this comment to maybe discharged, then you could go and save that and change that comment out as needed. Your next column pertains to your vital signs, and if you look at the column header, you will see a little caret to the right of the heart. If you click on that caret, it will bump out all of the patient's vital signs so that they are visible on the ED launch point. You can see that they are color-coded, so those things that are elevated will be in orange, things that are normal will be in black, and anything populated as low will be in blue. In addition, if you are interested in seeing more trends related to a particular vital sign reading, you could click on that and you will be sent into this screen, which, as you notice, we've been here before. This icon pertains to the patient summary. We're currently looking at the patient vital signs. So you can see the list of this patient's vital signs. you'll see triage and the latest. In addition, if you want to see more beyond just those 2 vital signs, you could click on this header for any of the vital signs, and you would be sent into a screen which provides you not only a graph, but a table of the patient's current vital signs. I'm going to go ahead and close this box, so you simply click the X by your patient's room number. If you hover over any of the vital signs, you will be able to see the normal ranges for that vital sign. I'm going to collapse my vital signs, and now we'll move on to our next column, which pertains to the various orders that can be placed on the patient here in the ED. For example, this pill represents medications. If I desired to place medication orders on my patient in CDU Bed 1, I could simply click that icon and I will be sent into this screen. As you can see, there are favorites listed to the right. If I wanted to order any of these medications, I could simply put a check mark in the box next to the medication name. When I do that, I can see that the medication order has moved to the tray, and you can see right now we have 1 order currently in that tray. If I wanted to add another order, I can simply click for a check mark and my number has gone up to 2. In addition, if I change my mind, I can simply remove it by removing the check mark. So we have a very nice list of order favorites that was developed when we first launched into the ED launch point. If at any time you think that there are other medications that you would like added to the list, you could simply have a ticket placed and we'd be happy to work on that. As you have orders placed from these order favorites, you would simply go down to the bottom of the box and click Sign. At which point we are receiving a dose alert. I'm going to go ahead and override that alert and say OK. And we'll say OK once again. So as you can see, we have signed the order. The tray is now empty and we have placed a medication order for this patient. Once again, wanting to point out that you can open your patient's chart from here, or if you desired, you could launch into further abilities to place orders by going to this icon which states Go to Orders, and we will do that eventually as we move through the process of training. You will note now that we have placed a medication order, it is visible to everyone looking at the ED launch point, and if they hover, they can see that there is an order for Toradol and that it's currently in the status of ordered and who has placed that order. As we move on, you will see the next column reflects that lab orders can be placed from the ED launch point as well. So if we click on that icon, you will see that it sends you into a screen where there are favorite lab orders. So if I wanted to place an order again, I simply click on the order that I desire. It goes to my tray and I slide down and sign. And my order has been placed. And for everyone to see that looks at launch point, they can see that this ethanol order has been placed, the time, the ordering person, as well as the fact that it says dispatched. So we can order EKGs in this way as well. So you can order an adult 12-lead EKG by simply placing a check mark in the box, pediatric ECGs as well, or if you just want to place your patient on cardiac monitoring. And we can go ahead and sign. So we have been sent into the primary order screen for this patient because when placing an ECG order, we have to give a reason for the exam. So if I click on that, I can see here that if perhaps my patient was here with chest pain, I could go ahead and select angina. All orders placed in the ED go in as stat, and at this point I can simply sign my order. and close. And everyone would see that there has been a 12-lead ECG order placed on this patient. As I move on to radiology, I have my favorites here as well. If I selected perhaps the CT of the abdomen, pelvis, it will go to my tray, and I can sign the order. It does send me to the primary order screen once again because I have a required field that needs to be filled in. So if I click on that, I can see that I need to pick a reason for exam. So I'm going to go ahead and grab something here. And once again, all the orders go in as stat. I come down to the bottom of the screen and I say sign. You will receive some clinical decision support pertaining to ordering of your radiologic exams, and that can be covered in personal training. As we move on, you can see there is a little medical bag here, and if we click on that, that pertains to patient care orders. If I wanted my patient ambulated, I could simply click in the box, the order goes to my tray, and I can sign it. And I will close that screen. Lastly, your column with the telephone reflects consults, and you can see here that there is a list of the various resources that you could consult, including ED physician, consult hospitalist for continued care. So if this patient is being admitted to the floor, I would place an order for my ED physician and then sign that order, or from a hospitalist and sign that order, and I have placed a consult order to the hospitalist. I would like to point out that if you place orders and you click on that icon, because perhaps in this case we needed a repeat EKG done on this patient, we could easily come down to the column that states reorder by my original order for a 12-lead. I could click reorder. It sends this item once again to my tray, and then I can sign it, and I have just placed a second, perhaps repeat ECG order. It will stop me because it thinks that I'm reordering and I don't want to, but of course I do. So I would proceed and say order anyway. Now if by chance I truly did want to remove that second ECG order, I could say remove, but I'm going to go ahead and say order anyway. And we can close that box. As you hover over various icons, you will see the status of orders, what has been ordered, who ordered it, and the time. This is very valuable because you can tell if you hover over this medication icon, you can see whether or not a particular medication has been administered or not yet. So in the case of the first order for sodium chloride, you can see that it's in an ordered status. It has not been completed, as opposed to the hydromorphone, which has been administered. There is further functionality within this column. If you were to click on this 12-lead ECG icon, you will see that there are various orders here on this patient. 2 of them were discontinued, but we do have 1 active order for a 12-lead ECG. If I go ahead and click that hyperlink, and if this were the live environment, I would be sent directly into that 12-lead ECG, and I would be able to complete my reading of the 12-lead. And that portion of education will be gone over when you have elbow-to-elbow support. We do read our own ECGs in the ER, the physicians do, and the PAs. They are evaluated at a later time by a cardiologist, but all ECGs except for pediatric patients are read by the ED physicians and PAs. I'm going to close that down. In addition, if I have a patient that has a radiologic exam, and if it is a simple radiologic exam, the physician would click on that icon, and in the case of the CT, that would be read by a radiologist or a teleradiologist if we did not have the radiologist on site. But if this were a simple chest x-ray, the physician, ED physician, or PA would click on an icon here, which looks like a clipboard with a drop of water. They would then go in and complete a wet reading on that exam, and that would be accessed by everyone as the reading performed by the ED physician. If we move on to this column here, this is your physician notifications column. This provides you with information about not only orders or labs or notes that need to be reviewed. So each of these represents various things that your physician is being notified about. If I click on this particular icon, I can see that there are actually 27 orders to be co-signed on this patient. And if I chose to, I could review them from here. So I can see any perhaps verbal orders that I have placed that now need my co-signature. And in fact, I could select them all, or I could deselect and review them individually, or only review portions of them, at which point I could then say co-sign, and those orders that I selected would have been co-signed. In addition, there is also the ability to co-sign physician notes here. So if you receive a note from perhaps your PA that needs a co-signature, you can click here and co-sign that note directly from the ED launch point. This indicator lets us know that there are labs for review. So if I click on that particular icon, I can see that this patient has 8 labs for review. And if I click review, I'm able to see here a flow sheet view of these current labs that have been resulted on my patient. I can also see a quick view of those same results, and that's personal choice, whichever you feel you like better as far as a view. And in fact, if I wanted to indicate that I was going to review all of those results from here, I could click Review All or Review All and close. And I have then closed out the box as well. This column pertains to the patient's status, which we indicated earlier when we spoke about the throughput status. And as you can see, the order that we had placed for hospital consultation on this patient in CDU1 has populated here for everyone to see. If you see the icon that looks like a key, it indicates to you that registration has not been done yet. There are various bed icons. If you see an icon with a bed and a check mark, it indicates that the inpatient bed is ready on this patient. So hover and you will discover, if you see a bed with an arrow, you will note that it means that a bed assignment has been made, but perhaps that bed is not yet ready. My next column is my length of stay. That column can be utilized to sort your longest length of stays at the top of the screen if you would choose to do so. Or you can put it back and it's just then sorted by your patient with the shorter length of stay. Most people will probably just sort their patients by room numbers with CDU at the top and the remaining room numbers proceeding from there. Your last column is your documentation column, and you will see various icons here. The blank sheet of paper indicates that no documentation has been started by you on this patient. If you see an icon that looks like a paper with blue at the top with lines, it means that someone is in progress in working on this document, perhaps yourself or perhaps the PA. The document is in progress but has not yet been completed. And if you see an icon that looks like a green piece of paper with a white check mark, this reflects that the patient's documentation is complete. So if I were to begin to place further orders on this patient beyond what I have seen here present in my orders columns, I can also place orders in a couple of different ways. So if I highlight this patient in blue by clicking on my throughput status column, I can right-click anywhere and I can launch from here into various sections of my patient's chart. Specifically, at this point, I would like to talk to you about launching into the orders. So if I click on Orders, you'll see that we're sent into the standard order screen within Cerner. If I click on Plus and Add, I would be able to access favorite plans. So if I opened this folder, if I had established favorite plans within the system, I would be able to access them from here. In addition, if I click on this folder, I can see common ED orders. So if I open that up, I have access to not only some additional folders, but also the ED power plans. You'll see that we have a folder for FTMC bolus medications. So if I open that, you will see various IV fluid boluses that are accessible. If I go back to my listing, I have common labs, common medications, common radiologic exams. We do have an order, this is an older order from CDU. We no longer have a clinical decision unit as part of our emergency department, but this folder remains. We also have a folder for the quality measures dashboards. But probably the most likely way that you will be placing orders is by utilizing the power plans. So for example, if I had an ED patient present as a female with abdominal pain, I can select this power plan. Power plans are symbolized by the square with the pieces within it. So if I selected ED abdominal pain female, I can see that it is highlighted in blue. I come down to the right lower corner and I can say Done. I can then see that the order set that I selected is present here, ED abdominal pain female. Slide that over. At this point, it has not been signed yet, so the initiation of this order set is still pending. If you peruse this order set, you will notice that the vital signs are at the top. It's not currently selected, but I can choose to select orthostatic vital signs, and that will be a part of my ordering set. You'll notice that the urine dipstick point of care is a pre-selected order, but if I chose to deselect that, I would simply take away that check mark. Perhaps I would like fetal heart tones or a saline lock placed. I can easily click on those to pull them into the order set or deselect them as I choose. You can see that the female patient admitted with abdominal pain is automatically put into an NPO status except for medications. You can see IV orders here. If I chose, the default selection is for normal saline at 20 milliliters per hour. But if I chose to, I could select a different IV fluid rate, normal saline of 125 milliliters per hour, and deselect the prior default setting. As you move down into the sections of this power plan, you will see that there is a section for medications. So if my patient was in pain and I wanted to order hydromorphone, I could simply place a check mark in the box by hydromorphone. The default order is for 1 milligram IV push, but if I choose to, I can select 0.5 if I'm dealing with a small elderly patient, or perhaps 2 milligrams if I chose to give a higher dose. You'll notice that as I select the hydromorphone dose 0.5 milligrams, it presents for me, because I have changed it from the default setting, it is a frequency of once, injection, stat. So just for my review, I can come to these double lines and I can pull this down and proceed through the remainder of my orders. I do have a variety of medications here for pain. I have a GI cocktail, and you can see as the list goes on. Anywhere that you see the large drop-down caret, it means that that dose is adjustable to you. My next section is laboratory, and it comes with some defaulted choices for a CBC, a BMP, etc. I can choose to deselect or I can choose to add things in it at my preference. You will notice that the urine analysis is ordered with a culture, and it does have that symbol which indicates that there are order details that have not been completed. So if I select that urine culture, if I right-click it and modify it, you will see that it needs to be specified how this urine is being obtained. So perhaps we're doing this after a Foley insertion. We're going to obtain a urine culture. That is the specific information that it needed for me to be able to continue to place that order. As I move into my diagnostics section, you can see here that if I needed to, I could order a 12-lead EKG from this power plan. And you can see there are other radiologic exams as well that are available from this section. So if I needed a CT of the abdomen and pelvis, it can be easily ordered from here. After I'm done selecting all of my orders, I can go ahead and hit Orders for Signature. So I'm going to place this power plan by clicking Orders for Signature. Because it is a power plan, I must then click Sign. I can see here that it's giving me a warning that there are duplicate orders. Perhaps if another provider had placed an order unbeknownst to me, I could remove one of these orders and then proceed. So I will go ahead and say Sign. Whenever orders are placed within our system, you will see this message that says Processing, please refresh. You would need to go up to your refresh button and click it. Your orders have now gone from processing to an order status, and you have successfully placed a power plan within Cerner. If we wanted to return to our patient chart, we could simply click on our patient's name, and we, from that view, would be able to see our patient's home phone number. I'm going to cancel out of there. If I wanted to return to what is known as the ED workflow, I can simply click on the White House here, and I am sent to the ED workflow. If by chance I wanted to get back to my ED launch point, I can simply come up to the ED launch point icon and click it in my toolbar. If at this point I would like to begin the process of creating a note on my patient, I can return to my patient's chart by simply clicking on the patient's name. And now I am back into my ED workflow. There is a menu within the ED workflow which is very much adjustable to the provider's preference. If by chance you chose to put your triage information at the top, it really is a great place to start because it provides you with your patient's initial vital signs, heights and weights, etc., as well as general information about the patient. So you can review all triage information here, including what was your patient's chief complaint, which you could read. You then move into your patient's subjective history of the present illness. So you speak to the patient, you obtain information about what's been happening from their subjective point of view, and you would simply enter that information here. That can be either entered by typing or through drag and dictation. At this point, when you had your subjective history of the present illness entered, you can simply hit Save, and it will save that. You can come back and add to it at any time. As you move on, you'll move into your patient's objective physical exam. And here we do have many auto texts available within our system for your assistance. So if I typed semicolon, semicolon, FTPE, I will see that there are a variety of physical exam auto texts ranging from the brief to the extended. And then, of course, we have a brief pediatric physical exam and an extended pediatric physical exam. I would like to show you the extended adult. So if I click on that and simply hit enter on my keyboard, you will see that this is our auto text for the physical exam. To proceed through, you would simply click on the drop-down carets and you're able to change your patient status for each of the assessment pieces here in the physical exam. So if my patient's skin was actually cool and moist, I could easily change those settings here. In addition, I can place my cursor anywhere and I can add additional information as needed by either typing or utilizing Dragon for dictation. If there was a particular area that was not checked because it was not needed, I could simply remove something by highlighting it and then deleting it from that section and then deleting the space. So it's very much adjustable to your preferences. In addition, wherever you see this icon, it will allow you to access the auto text. So if I click on that icon, you will see that I'm currently looking at my phrases. These just happen to be a few auto texts that I have personally created. Yours would be listed under my phrases as well. You also have access to public phrases. So for example, if I wanted to see if we had a public phrase on endotracheal intubation, I could enter endo and see that we do indeed have an ED endotracheal intubation procedure auto text. I can click on it from here and review it to the right. And in fact, if I chose, I could duplicate it and create my own personal auto text. We suggest utilizing ... in your initials, and you could name it whatever you chose to. You can or cannot have a description there. It's entirely up to you. If you'll remember that SP endo is endotracheal intubation, then you can just leave it as such. As you review the sections here, you can choose to deselect anything that you chose to by simply deleting it. You can add to sections as you chose to. So at this point in time, it is very easily modifiable for your preferences. And then you could simply say save. So what you will see when you look at your auto text now is that we have created an endotracheal intubation auto text that is personal. It is one of my personal phrases. To begin from scratch to create an auto text, you would simply go down to the plus sign and click it. And again, we advise using ... your initials. And I'm just going to illustrate here what you can do. I could call this hello, and then I could pick up my Dragon and begin to type whatever I needed to for this particular auto text. So I've created it from scratch. There is also the ability to create drop-down lists within your personal auto text. So by selecting, I could add various different items here for a drop-down list. So if I said that, and perhaps I wanted to add another one, I could continue to make drop-downs here and say create. So by seeing that you have the drop-down caret there, you know that you have two choices in that drop-down. And if you hit save, you have created your own personal auto text, as you can see it listed here. And in fact, if we back out of this Manage Auto Text screen, if I chose to come down a couple of spaces here, I could see that now I do have those two personal auto texts pertaining to myself. And if I wanted to pick the one that was perhaps the endotracheal intubation one, I could just hit enter, and I have pulled in my own personal auto text for endotracheal intubation. We would be happy to assist you with creating auto text. The next section, after we have completed our physical exam, it's important to come down to the bottom of that section and we would want to say save. So now we have completed both our subjective history of the present illness and our objective physical exam. At this point, we'll move into our review of systems. Once again, we do have auto text, so if you hit on your keyboard semicolon, semicolon, FTROS, you will see that we have a negative brief and a negative extended. I'm going to select the negative extended, and you will see here that I have the ability to use drop downs once again wherever needed to change things. In addition, as stated, we could go ahead and remove a section if it was not assessed and remove the space. And at any point, we can begin to add additional comments to any section via typing or via your drag and dictation. And I would save that section as well. At this point, it's important for you to decide how you would like to rearrange your ED workflow menu. Some choose to perhaps bring their labs up and put them with their review of systems. If they choose, they can come into the lab section here and review their patient labs. This patient will not have any labs because this is a training environment, but as you can see, you can set your view for reviewing your patient labs back to as far as 2 years. So you can pull in a lot of data here. It will automatically populate with the most recent labs, but if you're in the lab section and you're anxiously anticipating a lab result returning and you're wondering why it's not back yet, you might want to go ahead and hit your refresh for that section and just make sure that you are seeing the most accurate, up-to-date information. There are 2 different views for the labs within the ED LaunchPoint ED workflow, so you can change your setting based on your preference. The display does default to a facility-defined view, but it is adjustable, so make sure that you go in and look at your filters for your lab section, and you can adjust them if you don't feel that the facility-defined view is your preference. In addition, it's not uncommon for people to move up their diagnostics in their list of the ED workflow. If you do move up your diagnostics by your labs, you would be able to easily access from here diagnostic tests as they are resulted. So for example, if this were the result of a CT abdomen and pelvis that I'm waiting for, the one that we ordered prior, I could simply click on this link once it is resulted, and I will be sent into the PowerScribe report. In addition, if I click on the movie screen, it will launch me directly into the PAC system where I can view the image. There are also 2 large screens in the middle of where physicians and PAs document, on which you can review images as well. In addition, from the diagnostic section, I'm able to review 12-lead EKGs. So if this ECG was completed, I could click on it and I would be launched into the tracing. All of our ECGs are electronic. You can easily view it and read it from here. In addition, you can access things from here such as your patient's allergies and their current medications. Scrolling across the top would be your patient's prior 12-lead ECGs, and you could click on any of them to access that tracing. In addition, on your current screen, you would see the most recent ECG from today, as well as the most recent prior displayed for you for comparison. Don't forget that your sections, just like your lab section, your diagnostic section can be adjusted to look back in time, looking back in this case as far as 12 months. You can move up other sections here. For example, if you wanted to, you could move up your patient's home medication list, and of course you would be seeing your patient's home medications. In this section, nursing and pharmacists are generally responsible for the medication history, Although in the emergency workflow on a highly acute patient, or perhaps a patient workload with many, many patients, the ED nurses may not get a complete med history. They may only get the higher points like blood pressure medications or cardiac medications. When patients are admitted, the hospitalist will do an admission reconciliation. But you can come within this section, of course, and review the patient's home medications as listed. It is important to move up your assessment and plan, and in addition, your new order entry. Prior to those, though, you should have your problem list. So as you are reviewing your patient's labs, diagnostics, etc., you've examined the patient, you've spoken to the patient, you're probably at the point where you would be able to enter in some problems. And I think at this point I'm going to enter into a different patient chart, one who I think may have a little bit more information for us to work within. So if I enter this patient's chart, and you're seeing here a COVID-19 testing pending or positive alert, I'm going to go ahead and close that. You do have the ability to have 2 charts open at a time. We do have a 2-chart limit. I'm going to go ahead and close Easy Test May. And now I'm going to move down to the problem section for this patient. When I enter the problem section, I'm going to go ahead and uncheck these here for us so that we can have a clean slate. So we deselect these. I'll show you what it will look like when the patient first arrives. So when your patient first arrives, more than likely if they have been, and that abdominal pain is in there from us earlier, so that one is going to stay there. When your patient first arrives, you're going to see this section with their chronic problems listed. You do have the ability to make something go from chronic to this visit. If this patient arrived with abdominal pain but also with hypertension, I could put a check mark in this box by this visit, and now what I've done is I've made hypertension my patient's second identified problem that we are treating today during this visit to the emergency room. And you can see our abdominal pain, it is listed as number 1. If by chance you needed to change the listing of those in terms of their priority, you can easily drop down the caret and you can make one problem become number 1 and the other one drop to number 2. We'll go back to our problems list. So now we can see that we have our patient, and we may have actually removed our abdominal pain there, but let's go back to our problems. What we can see here is that this patient has the number 1 problem of hypertension. If my patient has resolved chronic problems, I can open that section and see, is there anything within this list of resolved chronic problems that may be actually a problem that is presenting today. And once again, by clicking this visit, you are able to take resolved chronic problems and move them up to be active current problems for this visit. And as you can see, the priority number 1 and number 2. In addition, you have a section for all previous this visit problems. If I were to open that section, if we had previous visit problems, those can also be brought up to the top and be active for this visit. So if this patient was having a recurrence of atypical atrial flutter, I could say this visit, and it has moved it up into the place of problem number 3. I can make those problems also chronic and this visit by just simply clicking chronic. Lastly, if we would like to add a problem that we don't see listed already, we can simply go up to Add Problem, and I'm just going to grab something here. So if I enter chest pain, you will see that there are a variety of chest pains listed here. I'm going to grab this first one, And by clicking on it, I have now added that in as problem number 4. You will notice there is an exclamation point in this circle by the problem of chest pain. What that indicates is that this problem has not been specified. So if I click on that icon, I will be sent into what is known as the Diagnosis Specification tool, at which point I can look at the various categories and begin to narrow this down from a very unspecified chest pain. So if I were to say acute, you'll notice that it narrows things down for me. So other forms of acute ischemic heart disease. It is telling me I am done. I have specified it as far as I can. If I hit save, you will note that in the problem section, that is no longer an unspecified problem. It has been specified to its highest degree. If I wanted to change this acute ischemic heart disease to number 1 as my patient's number 1 problem, I can simply adjust and it places it at the top of the list. It's extremely important to place your problems before placing orders, because if you do place orders after your problems are identified, if at all possible, you will be able to see, if I place an order here, I'm going to just go in and place a very quick order for a CBC. You will see here, here's a CBC with an auto diff. I'm going to select that. So I searched, found my order, I've clicked on it, and it's gone up to my Amazon tray. If I click on that, I can then see that this is a diagnosis table. So every diagnosis or problem that I have identified is now associated with this current order for a CBC. If I chose to, perhaps I'm ordering this CBC for the acute ischemic chest pain that this patient is having, but I don't want it associated with the hypertension. I can easily deselect this by removing it, and it renumbers the remainder of my problems. I can choose to deselect these others and leave it associated to just the ischemic chest pain that my patient is having. If I am in my order screen and I decide that I don't want to order this anymore, I've changed my mind, I could simply remove it from here. In addition, if I take away this always default association, all of the diagnoses will not be associated to the particular orders that I place, and I can begin to associate them manually. At this point, you can go ahead and sign your order, and you have placed an order for a CBC, also associating it with the problems identified. So once that is done, if you go into your assessment and plan, you will see that the problem of ischemic heart disease has been associated with the order for the CBC. So essentially, it is like building your assessment and plan by recognizing your problem and then doing your new order entry. In this section of assessment and plan, you do have various fields where you can enter your cursor and just begin to add additional information as needed. And if we scroll down slightly, you will see that there is a field at the bottom for further comments. At this point, I would save that section, and I have built some of my assessment and plan. As we proceed through the remainder of the ED workflow, you will see that there is a section for you to review histories. This section pertaining to problems reflects your patient's chronic problems. And as you can see them listed here, your patient has 6 chronic problems. You can also see that this particular patient has 3 resolved problems: abdominal pain, nausea, and vomiting. So that is the problem section of your histories. You can move on to review your surgical section, so you can see both surgical records and surgical procedures listed within this section. You can review your patient's family history from here, and in this case we see a father with Alzheimer's. You can also review your patient's social history. So does the patient drink alcohol, use substances, or tobacco? In this case, it is negative, but you can review that information from here in your history section. The next section is your document section. In this section, you will see various documents that have been created on your patient previously. So in this case, we can see that there was an ED note created a few weeks ago perhaps, and if you wanted to look at that note, because perhaps the patient is presenting with the same symptoms, you could easily click on that ED note and it will appear for you to the right. If you want to view the document as a whole, you can easily click on View Document, and you will be sent into a larger screen if it's easier for you to read. In addition, sections within this note prior are easily tagged by simply holding your cursor, your right click down, highlighting the area that you're choosing to tag, and then waiting for the tag icon and clicking it. So if I get back out of this original note, I will be able to see that I have a tagged item from that note. And if I click on it, I can see that is the section of the note that I tagged. You are able to tag sections from prior notes, and they will come into your note. If you drag and drop them in, they will have a footnote indicating who was the original author. And it is intended for you to go in and change that so that it is your own personal work. Change the portion of information that you tagged. So I'm going to go ahead and close that out. But you can see the listing of previous documents on this patient, noting that we are seeing the last 50 notes. You can sort by just viewing your own notes. So if you know you've cared for this patient in the past and you just want to see your prior treatment of that patient, you can select My Notes. In addition, you can group notes by encounter. So if this patient happened to have been here a few weeks ago and they had a specific encounter that you're interested in, you can group them as such. You also have the ability to change the filters of your documents by simply clicking Change Filters. Currently, we are selected to physician documentation, but perhaps I want to say that I want to filter emergency documentation, or perhaps I want to see all documentation. Utilizing your filters allows you to determine what types of documents you will be viewing, and you would simply say Apply. In addition, just like other sections, you can sort your documents going back in time, and you can see that in this case you can go back as far as 2 years and view documents on your patient. As we move on to the vital signs section, you will see vital signs that are obtained throughout the course of the patient's stay within this section. In addition, you can go back in time. So if I chose to, I could go back as far as 12 months and I could view vital signs on my patient. If I'm wondering, is this where my patient normally lives as far as their blood pressure, I can look back in time. There are 2 different views here as well based on your preference. Don't forget to refresh the section if you're waiting for new vital signs to come in. There is a section called Clinical Media. This section provides you with images obtained from the end of a scope. So for example, you might see images here from an endoscopy procedure, or perhaps a patient had a pulmonary procedure. You would see those images here, and they are taggable if you ever chose to pull one of those images, it's actually a photograph, into your note. They can be tagged from clinical media. The next section is visits. Within visits, you will see your patient's previous 5 visits. So if you open that up, you'll be able to see, if you think the patient has been here recently, you can look back in time and see. Or if perhaps they were at our hospital but in a different capacity, you would be able to see, for example, this patient had been a patient in observation back on March 3rd of 2020 up on the 2nd floor with chest pain. Order profile will provide you with a listing of all the orders that have been placed, and you can see that listing here. In addition, from order profile, you'll be able to see the status of the order. So if you've placed a medication order, for example, Toradol, and you're wondering, has that medication been administered yet? If you look at your order profile, you will be able to see the status as completed or still in an ordered status. There are filters here as well in which you can filter the view of your orders, but in reality, in the ED workflow, you would probably be leaving that filter set to all active orders. You can group orders by clinical category, order type, or none. In most cases, you will leave that set to clinical category. And that would be these individual sections here, like communication, IV solution, and medications. Outstanding orders will list for you things that have not been completed yet. So for example, if you ordered a 12 lead and it's still here as ordered, you know it has not been completed. Within outstanding orders, you will also see future orders. So if I'm a patient that perhaps goes to an outside provider within our system, and they have placed a future order for something, maybe a type of x-ray or a lab result that I'm supposed to have for a few months from now, you would see that in the outstanding orders, specifically listed in the status column as a future order. Medications this encounter will simply list for you the medications that have been administered for this particular stay, or in this case, not yet administered, but in the status of ordered. So medications this encounter will allow you to easily review what medication orders have been placed, including IV fluids. As we move into the microbiology section, it will provide you with all microbiology results, and they would be here as a simple click of a hyperlink where you would be able to view not only the culture, but the sensitivity report. Any positive cultures would appear on your screen with the letters POS in red, which would let you know that that is a positive culture. This section allows you to go back 2 years in time. Very similar, the pathology section, you would be able to access pathology reports from here, and you can go back as far as 18 months to view pathology. There is a section called NARCS Care, and this is the section that allows you to access your patient's history of receiving narcotics prescriptions, very similar to what prior was utilized, the ORS report. But in fact, within Cerner, there is a new workflow which utilizes NARCS Care. So if you do have access to it, you would simply click it, and it would not only show you your patient's prescription history, but it would also show you a score indicative of their risk for overdose. There is a specific workflow which you will be instructed on how to show that you have viewed the NARCS Care report when you have elbow-to-elbow training. The procedures section allows you to document procedures. So if I had a patient that was here perhaps with a laceration, I could utilize the ED laceration repair auto text, and by simply hitting enter, I'm going to retype that here, so I'm going to do a semi ED LAC. That is my laceration repair. If I hit enter, you will see that it is a full template That provides you with all the drop downs that you would need to document on a laceration repair, including a timeout, things like the type of, the length of the wound, the location, the shape, the depth, what did you use to numb it, clean it, sew it. So all of this information is available for you within the auto text. In addition, remember that you could go out to your Manage Auto Text and you could create your own personal laceration repair auto text. There is a section for medical decision making, which is simply an auto text or a free texting box where you could enter in your medical decision making by either typing or dictating and hitting save. There is a section for quick visits. It's not often used, but it was developed for those quick types of visits that perhaps a patient comes into the split flow area and maybe just has a very simple laceration or an otitis media. I'm going to go with the otitis. When you click on it, you can see that it allows you to not only document your patient's problem, but to do the review of systems. In addition, the physical exam. You can even prescribe from here. So if we needed to prescribe something for pain and an antibiotic, we could easily do that from our quick visit. Not only that, but we can document our patient education and their need for follow-up. So it's a quick way to document on a simple type of patient visit, and it's done via the quick visits section of your ED workflow. Finally, when you get to the bottom of your screen, you will see that you have made it through every section of your ED workflow. At this time, you can create your ED note by simply clicking ED note. All of the sections that you have completed prior will populate into the sections where they belong. For example, your review of systems that you completed in the workflow. The chief complaint has also populated. If we had completed our history of the present illness, it would be present here. But at this time, we're able to add anything in that we choose by simply clicking on the back arrow that says Insert Free Text. So if I click there, I can begin to enter whatever I need to within this section for the history of the present illness. As we move down, we can see the patient's physical exam here, and it would populate with the most recent vital signs, height, weight, and BMI. This is still very moldable at this point in time, so if I chose to, I could simply click on my Insert Free Text, and I could be entering in further information as needed. If by chance we know that there is a set of vital signs that we feel better reflects the patient's current condition, we can simply come to this refresh this section, and we would be pulling in our most recent vital signs. Within the images section, I spoke earlier about being able to tag pictures, for example, from an endoscopic procedure. This is where you would drag and drop those images into the section called Images. You can see because we documented a procedure on this patient, we do have a procedure section that has pulled in from my prior documentation within the workflow. There is a section for medical decision making, and of course at this point in time I could add to it quite easily by simply clicking on the Insert Free Text, and I can begin to enter more information. Your assessment and plan will illustrate the degree to which you have completed it within the workflow, but once again, it is very easily manipulated at this point in time prior to signing your or signing your note, where you can add, of course, more information. If by chance you chose to exclude something, maybe you decided that this particular patient did not have the problem of atrial flutter, you could simply come to this atrial flutter here and remove it from that section. Now, it would still be present in your problem, so if you needed to remove it from there, that would be a second step, but you have removed it from your note. Medication administered will illustrate for you all the medications that have been administered during the stay in the emergency department. You do have a section for disposition, so patient discharge condition, you can easily click your backward arrow and you can say admit, regular floor. In addition, if your patient is being discharged, you can indicate that this patient is being discharged back to the nursing home. And of course, if we had placed any prescriptions on our patient, we would see them listed here. I will show you prescriptions when we get in more into the discharge workflow. You can see a section for follow-up, and I'll also reserve that in patient education for our discharge process. There is a section for attestation, so if we're in that section, we do have an attestation auto text that many of the medical students, when we have them, utilize. So if they type semicolon, semicolon, ED attestation, you will see that they are able to indicate that the patient was treated and evaluated by the, and they can choose medical student. They could even type their name in there. And I often advise them to put the attending physician, comma, and then that physician's name was present at all times. So this is a nice attestation statement that we have created as an auto text. If we scroll back up to the top and review the right-hand side of the note, we can see that there is a section here with the patient's problems and past medical history. You can find their ongoing problems, so their chronic problems, and also things that are historical. But if by chance you had anything in here that you chose not to include, you could X this out of your note. Or if you had something that was in there as a duplicate, you can remove them and kind of clean up that section. You can see that there is a tonsillectomy documented here, but perhaps you know that there is another surgical procedure that's very relevant. So you could enter that in quite easily. You can also see the patient's inpatient medications listed here, as well as their home medications. You can note their allergies, but if by chance you knew that there was an additional allergy, it could be added in here as well. I would be speaking with my staff in order for that allergy to go beyond the location of this allergy section in your note, for the nurse to in fact add any relevant allergies to the allergy section of the chart so that everyone would be aware that the patient has a new allergy perhaps. You can see all of these sections can be manipulated to add in further history as needed. The lab section will reflect the lab results that have been resulted while the patient was down in the emergency room. So you will see a very nice table there reflecting the results, even with the time and date and the color coding of results that are abnormal. Diagnostic results will also pull into your note, but if by chance you had tagged an item and you wanted to pull it into your note, I'm going to use this example of something that we tagged earlier to illustrate how tagged items can be dragged and dropped right into your note. You have to wait until you have the little blue dots visible, and then you can simply place it within that section. And I lost my blue dot, so I'm going to grab him again, and I just drop him down in there. And you will see that he has populated there into that section. And at the bottom, you will note that there is a number 1 at the bottom of the piece of tagged material. And if you scroll a little bit further down, you will be able to see that it is footnoted with the name of the person who originally entered that text into the note from which we tagged it. It would be important to go back up into that section if perhaps you tagged a section from another provider. You would want to go into this section and change things to make it your own. So if I use my back arrow, if I wanted to change a statement here, I could easily change that, but not recreate the wheel necessarily if there is something that I needed to tag that is still relevant for this patient. You will notice that your 12-lead ECG results will populate within this section as well. At this time, I would like to take us back to the workflow. I'd like to speak to you about the discharge process. So to get back to my workflow, I will simply click the back arrow, and as you can see, we're back to the ED workflow. I want to skip over to the ED discharge workflow. And in fact, this section can be picked up and moved right next to your ED workflow if you chose to. If I click on the ED discharge workflow, you'll note that it has a small menu, and this can be adjusted as well. So if I chose, I could move my NARCS care up to the top, or I could move my prescription up to the top because that's what I might be using most often. So if I see prescription here, I can easily enter a prescription order by clicking on some common orders. So there are some ED common prescriptions that can be accessed from here. If I go ahead and open this folder, you'll see that there are common antibiotics, common narcotics, pain meds. I'll go ahead and open up the common antibiotics folder. So if I click on that, you'll see there are many common antibiotics that you can access from this home folder. In addition, you can build your own favorites folder in the section called Mine, and it looks like this physician has made one favorite pain order. We're happy to assist you with creating your own personal favorites, whether they be orders or auto texts. You also have access to public folders, and those are very similar to your home folders. In fact, they are the same. If I wanted to order for this patient, let's just say a pain medication, I'm going to open up this Pain Meds FTMC, and as we can see here, I'm going to scroll down, and I think what I'd like to order, I think in this case I may go back to my search field, and I'm just going to order a Tylenol. So this is me searching within the search field for Tylenol, and as you'll note, the various choices for Tylenol have appeared below. I'm going to grab this 650 oral tab. By clicking on it, I've sent it up to my orders tray. So if I go ahead and click on that, I can see that I have Tylenol sitting here. And I can go ahead and associate that. If we were going to say, for example, maybe this atrial flutter said fever, I could go ahead and select that, and that would be tying my prescription order in to a particular diagnosis. At this point, I'm going to say sign. And what you will see is that this is a prescription. And if you hover over the pill bottle, you'll see that is what it illustrates. But there is a required field here. So if I click on this particular order, you can see that I have to indicate the number of tablets to be dispensed, of course, because this is a prescription. So if I wanted 20 of these tablets to be dispensed, and perhaps I wanted the patient to receive one refill, you will note that the dose is 2 tabs orally every 8 hours, 20 tablets with 1 refill. You'll note that the start date is today. If by chance there's a medication I'm ordering that I would not want my patient to continue past, say, for example, 7 days, I can click 7 days of duration and it will put a stop time here for 7 days from now. It's also very important to note the difference between acute and maintenance. Most often ED orders will be entered as acute. So if in fact I'm ordering a pain medicine, I would want to change that from maintenance to acute. You will see that there are other fields here. For example, the dispense as written, yes or no. Print DEA number, yes or no. And then there is a place for you to make a note, an ERX note to the pharmacist. So this would not appear on the prescription itself, but it would be visible to the pharmacist. You can associate a diagnosis from here as well as you place a script. And in fact, for anything that is a narcotic, you would want to have one diagnosis associated with it. So if this were a narcotic pain medicine, I would want to come down here and say, yes, I'm going to associate this narcotic pain medicine to bilateral lower back pain. So it's quite easy to associate a diagnosis from here as well if you have not done it originally on your diagnosis table. Finally, you need to indicate where you're sending this prescription. You would be set up with the prescription printer that is present down in the emergency room, where you could electronically send it to the local printer. The prescription will then be removed from the local printer and signed by yourself and then given to the patient by the nurse discharging the patient. But if by chance you would like to send the prescription to a local pharmacy, nursing is responsible for entering in the patient's preferred local pharmacy. By routing that prescription to the local pharmacy, you then prevent the patient from having to go inside to pick up their prescription. At this point, you would simply say sign after your choice of routing. I wanted to point out to you, there is an external RX history which is available to you when you are in your order section. If you utilize the drop-down caret, you will see that you can view the external RX history. This will provide for you a fairly accurate listing of patient prescriptions. So beyond what your NARCS Care report will provide you, this will have everything. So if the patient was ordered a diuretic or an antihypertensive or an anti-anxiety, you will see it listed here with lots of helpful information. Things like when was it refilled last, what quantity, including, if you scroll to the right, you'll be able to see even who prescribed it, how many refills, what pharmacy did the patient have that routed to. So it's a very valuable tool if you're dealing with a patient that perhaps cannot state their medications, does not remember, etc. I'm going to cancel this prescription for Tylenol, so I'll say yes. But as we move on through this workflow, within prescriptions, I want you to note that there is a shared folder. So if I click on shared, I can then enter a provider name. So if I know that a particular provider in the ED has wonderful favorites folders already established, I can click on that individual's name and then I can actually have access to a variety of favorite folders which are shared between providers. You do have access to NARCS Care from here, just as you did from within the ED workflow. You have access to patient education as you're doing your ED discharge. So based on the problems that you have identified for your patient, you will see a listing of suggested education to the right. So because we have atrial flutter as one of our listed problems, we do have atrial flutter as a potential option for patient education. If I click on that, I have added it to my patient's discharge packet. And you can add multiple things to the discharge packet. You'll know you've added it by that temporary illustration there that states it's added. But then if you scroll down, you will see that the education pieces that we just added are listed here. If by chance I wanted to remove something, I can simply hit remove and it will take it out of the discharge packet. If I wanted to modify something, I can click on this atrial flutter and then I would see, if I chose the atrial flutter, I can come in here at any point and modify what is our pre-existing discharge instructions. go ahead and say OK to that. So that is your patient education. In addition to searching by what is your patient problems, you can go out and do more of a search by clicking on More Options. And as you'll note here, I could type in here high blood pressure, and you will see that you could find lots of information through this search and add in your chosen piece of information quite easily by just simply clicking on it. So that's your patient education portion of your ED discharge. Finally, you can move into your follow-up. You will see that your patient's primary care provider, in the case of this patient, we have a PCP listed up here in the banner bar. If we wanted our patient to follow up with their PCP, we could simply click on that individual's name, and we have added that as the follow-up. If we come down to the bottom, you will see that it defaults to follow up with your primary care provider in 3 days. But that can be modified. If I left-clicked Modify, I can change that to perhaps we'd like you to follow up within 2 days. And there is even a field for comments. Perhaps you want to say only if needed. So you can add comments, and there sits your Manage Auto Text. So if you wanted to develop auto text pertaining to these comments, that would be a great workflow to enhance your speed. There are also some standard predefined comments that can be added in as well. So maybe there was an appointment made and you want to say keep that scheduled appointment. It will add to your free text box there if you make a selection. At this point, you would simply hit save, and you have placed a follow-up appointment if needed, 2 days on this patient with their primary care provider. You will see that there are many other locations that can be chosen. So for example, if we wanted to have the patient follow up with the Huron County Health Department, we could select that, and once again, it is easily modified by clicking Modify. All of our diagnoses go in as discharge diagnoses, but if you're in the process of doing your ED discharge and you're thinking about, I really should have added in an additional problem, you can easily do that from here as illustrated prior. You can review your patient's vital signs from here. You do have access to the quick visits from here as well. You can access the order profile from here, which allows you to check on what orders were placed while the patient was in the emergency room. And lastly, you can view documents from here. At the time that you're ready to create your discharge instructions, if you have moved through your Depart workflow, you can move up to this door, which illustrates that this is your entry to the discharge process. So if I click on that, you'll see that I am sent into the discharge. This is your discharge paperwork, which at this point should be complete. If by chance you needed to change anything, for example, you're in this workflow now and you forgot to place a prescription order, you can launch from here. If by chance you wanted to add in additional patient education, that can also be done here. If you wanted to modify your follow-up as well. And if by chance you're here and you want to open your patient's chart, you can easily click the pencil and you'll open the patient's chart. This is stating that this patient is ready for discharge, and that is an indicator for nursing to know that the Depart has been completed. If your patient needs an excuse from work or school, that is currently on paper, and they simply use a copied paper in order to give that to the patient. You would come down to the bottom and click the box that says Patient verbalizes understanding of the instructions given, and then you would slide over to Print. At that time, the discharge instructions will be printed in a packet to the local printer. They will be put on a clipboard with any prescriptions that the patient might have been given, and at that time the registered nurse will take the discharge instructions and the prescription and provide them to the patient. Within this workflow, we also have access to quick orders and charges. So if I click on that, you will see that there are various what we refer to as components. I'm going to click on this icon here and close those components so that you can see them better. So if I click on Collapse All, you'll see that the components have closed down. If I have a patient arrive and I want to place some cardiology orders quickly, I can utilize this ED cardiology component by opening it up and selecting a medication perhaps, or even an exam like a 12-lead ECG. I have a section for ED meds and IVs, which would allow me to easily place an order, for example here for an oral pain med. But maybe in fact I need an antibiotic. I can open that section and I'll see that there are some antibiotics listed there. It would then place that item back up in the tray for signing. If I chose to change my mind, I can click it again. It's no longer green and it's no longer in my tray. ED radiologic orders can be placed from here, and in fact this can be a valuable section to order a quick radiologic exam. It probably provides you with the best access to the exam that you really need to order. If you go out searching for an exam, you may in fact order the wrong radiologic exam. So in the beginning, when you're first learning the system here at this hospital, this is a great place to go to order your ED rads. And you can see you have ultrasounds and then regular x-rays as well. There is a section for ED labs, and if you open that up, you will see a variety of labs that are accessible from here if you choose to order from your quick orders. In addition, you have patient care items, consults with all of the suspects listed, but maybe there are patient care items that you would like to have placed. For example, maybe you would like a nasogastric tube inserted, and you could simply place that order from here. Lastly, in this section, you can see that there are the ED power plans. So if you open up the ED power plan section, you will see all the typical power plans that we saw when we were in the orders section. And you'll note there's that female abdominal pain power plan, same power plan, just accessed from a different location. You do have access to new order entry from here, and in fact, if you chose to, you could click this icon here and you'll be launched directly into what is the traditional order screen. As we move across, you can see that you have access to advanced directives here. If you click on that icon, and if your patient has advanced directives, you will see a hyperlink that you're able to click, and you will be looking at your patient's scanned documents. There is one last piece here, which is your M-Pages view. It's really a summary page, and in this case you can see it has a summary of labs, vital signs, documents that have been placed on the patient, which you could easily link to by clicking on the hyperlink. So this is yet another location for you to easily access information about your patient, including what is a valuable calculator known as the MedCalc 3000. In fact, if you search this by specialty, there is a location for emergency medicine. The MedCalc 3000 allows you to access valuable information in the form of formulas that you can then enter data which is specific to your patient, and then in fact, once you have completed the calculation, you could copy that to a clipboard and then drop it into your note. So if we return to our ED workflow, you can see that we're back to our patient's chart. And if you are in your patient's chart and you want to return to the ED launch point, it is easily accessible from this location, ED launch point. We do have access to our prior tracking list, and it is utilized by some of our providers. In fact, it is still utilized by our nursing staff. But our providers will go into the tracking list in order to access what is known as the FTMC 72-hour lookup. By clicking on that, you will see the listing of the patients who have been through the emergency department, whether admitted or sent home, via this 72-hour lookup. And lastly, they also will utilize the FTMC 12-hour admit lookup, which would allow you to see all patients who have been admitted to the hospital within the past 12 hours. I would also like to speak to you about the Message Center. The Message Center is essentially an email from within Cerner. Most often, the emergency physician will be using it for accessing orders. So for example, if a verbal order was given by the ED physician and a nurse put that order in, it would be important for the ED physician to come into the Message Center and review any verbal orders that were given and co-sign them. That can be done from your ED launch point, as we illustrated earlier, or it can be done here from your Message Center. In addition, you will have your saved documents here. So if you had a document that you were working on but were unable to complete and you saved it, it will go to your Message Center, at which point you can open that document and you can proceed with work on that document. You can sign it. If it was a preliminary report, you can still manipulate it. If it had been signed, your only choice would be to add a modification to it in the form of an addendum. But if it is truly sitting there as a saved document and has not been signed prior, you would find it here. You will also receive in this section documents from perhaps medical students, perhaps a resident, and also from your PAs for co-signature. So it's very important for the physician to go into the Message Center, review any documents that need to be co-signed, review orders, and perhaps also complete saved documents of their own. I wanted to point out to you that you have access to up-to-date Hippocrates, PubMed, and CDC. You should not use the ORS report because you have access to NARCS care within Cerner, so that should be your resource for that information. The FTMC antibiogram provides you with a listing over the years of organisms that have been isolated within our facility, within our community, and it also provides you with a sensitivity report. So the FTMC antibiogram is an easy link from your toolbar. You have access to a simple calculator as well as ad hoc forms. Ad hoc forms are simply forms within Cerner that are utilized by both physicians and nursing in a structured manner similar to if you had a paper form, but it is electronic. Patient pharmacy is the icon utilized by nursing to enter in the patient's preferred pharmacy. If by chance you are not sure if a patient pharmacy had been entered, if you are within a patient chart, you can click patient pharmacy and you would be able to see, is there a patient preferred pharmacy if that patient had asked you to send off a prescription to a local pharmacy. I wanted to speak with you for a moment about accessing forms that are important to the physician. Mostly, forms are accessed by the physician via the ED launch point. So if we return to the launch point, and if we were talking about this particular patient in CDU bed 1, whenever you have your patient highlighted in blue, you can right-click anywhere in that blue area and you can see that you have access to sections within your patient's chart. For example, you can access the ED view by simply clicking ED view, and you will be launched into your workflow. If we return to the launch point and right-click once again, if you click on ED Summary, you will be sent into a very nice summary that synthesizes information about your patient, including things like documents, vital signs, labs, and even diagnostic results, which can be easily launched to via the hyperlink. If you return to your launch point and right-click once again, you can access Results Review from here. And this would send you to our standard Results Review, sort of our older view. With recent results, you have recent labs, extended labs, and you can see the various tabs here, including diagnostics. Once a radiologic exam is resulted, it will no longer say in progress, and you can access the PowerScribe report and even launch into the PAC system from this results review section. If you return to the ED launch point, you'll see you can enter the diagnoses and problems section. Orders. Documentation is more of our old style documentation, so I wouldn't imagine that you would want to be going in there. Lastly, in this section, you have the interactive view and I&O. If you click on that, you're going to be able to see more of a nurse's view of documentation, including vital signs, and if you are interested in perhaps the patient's intake and output, you can access that from here. Returning to the launch point, I would like to show you how you can easily access patient forms. For example, the NIH stroke scale. If you click on that, you will see that you're sent directly into the NIH stroke scale for easy access. If you complete the form, you will sign it simply by clicking on the green check mark after confirming that your date and time are corresponding to the event. Not only is the NIH stroke score accessible easily, but also your CVA, TPA, inclusion-exclusion criteria. So if I click on that, you will see I'm launched into that form, and I can easily select no's and convert to yeses those things that apply. Yellow screens within Cerner reflect required fields. So once I have all of my complete documentation on my TPA, CVA, inclusion-exclusion criteria, I can come up easily and sign that form, and I have completed that review. I wanted to show you, as you launch into a patient's chart, you may have noticed that there is a menu that sits to the right. This is our older style workflow menu. You can pin it down if you choose to, and you can utilize it, but we strongly suggest that the best workflow is currently within the ED workflow, as we illustrated prior. When you're ready to close down a patient chart, you can simply click by the patient's name to X that chart out, and you're back to your ED launch point. You will be able to view your most recent chart entered, listed here, right above the launch point. And in fact, if you drop down your recent caret here, you'll be able to see a listing of 5 to 10 patient charts that you have been in recently. And in fact, if we drop down this caret next to our patient's name, we are able to access different sections of our patient's chart directly from their name. Lastly, you do have a search field in which you would be able to type in any patient's name and begin a search. And as you can see here, if we did have a patient by this name, we would find them within this list. And as we stated earlier, your refresh button sits right below. When it's time for you to check out, you can simply come to this drop-down caret and click Check Out. And if you go ahead and say OK, you have just checked yourself out. If you come to your patient name, you can unassign yourself. And lastly, I would like to say that to exit from the system, best practice is to come up to your task in your toolbar and exit. And of course, when you walk away from the computer, you should always click Control and tilde in order to lock the screen for the next user. This has been an instructional video pertaining to the workflow of an ED physician utilizing ED LaunchPoint within FirstNet.